Okay, good afternoon, everyone. Welcome to TLC Academy. My name is Nurse Sousie, and Director of Nursing at TLC Homecare. And today I'm bringing you a subject that may be significantly impacting some people in your world around you. It may not be also, but I think the importance of this information to you as a provider of care and as a professional is really important information. It has to do with what is known as substance use or abuse disorder among professionals. And what I want to help you to know today is, what do we need to know about it? Substance abuse disorder, or SAD as I put it, is a pattern of behavior. The behaviors are expressed as misuse, dependency, and addiction. The behaviors are usually experienced sequentially, which means one does not become an addict after the first drink, or a toke, or the first pill. However, the route used for introducing a drug into your body does strongly alter the onset of addiction. All of these agents may contribute to substance abuse disorder. Alcohol, nicotine, legal drugs, or illegal drugs. The worst of these levels of disorder is an all-consuming addiction. Addiction is regarded medically as a complex disease with serious physical, emotional, cognitive, spiritual, financial, and legal consequences. Substance abuse disorder can affect anyone, including an unborn child. SAD is progressive and chronic. SAD can be successfully treated. Alcohol remains the drug of choice for the general population at large. However, the rising availability of legal and illegal substances in the world today has brought about significant shift away from alcohol use by itself to combination use that may include a myriad of other addictive substances. Undoubtedly, many of today's households contain mind-altering chemicals, and many of them are addictive. Consequently, more people are able to access these substances than ever has before in our history. In particular, healthcare service providers like doctors, nurses, and nursing assistants frequently find themselves with ready access to controlled substances. And in the course of their work, those pose challenges. It would follow that this ready access may contribute to a higher incidence of dependence among this group of professionals. Chemical mind-altering substances result in long-lasting changes to your brain, which is why addiction is a chronic and relapsing brain disease. Practically, the earlier substance abuse disorder is identified and treated, the sooner and more easily a person can recover. It has been proven that there is greater and longer lasting success in recovery when support is group-oriented. It's highly unlikely that an addict can kick the habit alone. Substance abuse disorder is a challenging and complex issue for healthcare providers. Nevertheless, with the help of supervisors and colleagues who observe astutely and willingly offer compassionate support to a colleague who is experiencing SAD, the disease can be identified promptly and intervention conducted sooner rather than later. Concerned and occupied with your own duties, you may not always recognize the warning signs of SAD in a colleague, whether he be a supervisor or a teammate on your level of practice. Or you may misread cues and look for other explanations for questionable behavior. Ultimately, this is why many professionals with SAD remain unidentified, unreported, untreated, and they may continue to practice where their impairment may endanger the lives of other people. SAD among healthcare providers also creates significant legal and ethical responsibilities for colleagues who work with the individuals. You have a professional and ethical responsibility to report a colleague's suspected drug use to your manager or your supervisor, and in some states or jurisdictions, to the Board of Nursing or other professional bodies which provide oversight of a specific discipline. Your role in helping to identify colleagues with SAD is vital to the best practice and client safety that we can offer. Therefore, it is necessary for you to be aware of the indicators that may signal that a colleague has a problem. Often it can be hard to differentiate between the subtle signs of impairment and stress-related behavior. But there are three things that you should watch for: behavior change, physical signs, and drug diversion. Behavioral changes include some of these: changes of or shifts in job performance, absences from the work site for long periods of time, or repetitive absences that follow weekends and form a pattern over time. Arriving late or leaving early frequently. Frequent trips to the bathroom. Making excessive mistakes, in particular medication errors. Failing to properly document the administration and management of controlled substances. Subtle changes in appearance that may escalate over time. Increasing isolation from colleagues. Inappropriate verbal or emotional response. And finally, diminished alertness, confusion, or even memory lapse. There are cases when a colleague may be using drugs and is unable to obtain them from a prescribing professional. Sometimes the individual may turn to the workplace for access or diversion. This unprofessional activity often is noticeable in the form of controlled substances discrepancies. Such discrepancies can include incorrect narcotic counts, large amounts of narcotic wastage, numerous corrections of medication records, frequent reports of ineffective pain relief by care recipients, offers to medicate the care recipient of other colleagues for pain, altered medication orders, and recurring variations in controlled substance discrepancies among shifts or days of the week. The earlier SAD is identified and treated, the sooner care recipients are protected, and chances are better that the affected professional will be able to return to work. It is essential that we acknowledge that healthcare professionals are not immune to developing a substance abuse disorder. It is imperative that we ignore stereotypes of what a typical person with a disorder looks like. It is important for us to not only be aware of the warning signs of SAD, but to also be cognizant that SAD is a disease that can affect anyone regardless of age, occupation, economic level, ethnic background, or gender. With these criteria in mind, you should be better able to see in a colleague or others the warning signs for SAD without the notion of a responsible health professional wouldn't do that, or someone like him would never have a substance abuse disorder. In most states, health professionals may enter a non-disciplinary treatment program which is designed to refer the professional for evaluation and treatment, monitor the compliance with treatment and recovery, monitor abstinence from the drug or alcohol use, and monitor their practice when they return to work. When a colleague with SAD returns to work after treatment, it is vital that you help to create a supportive environment that encourages his continued recovery. While you can't do the work of recovery for the affected person, you can convey through heartfelt compassion that the affected person remains a valuable colleague and maybe even a valued friend. In conclusion, I urge you to continue your education about substance abuse disorder, for the pain of it may be lurking in your work environment. And before I close, I do want to let you know that the state of Vermont does actually have a remediation program that they offer to professionals who are identified with substance abuse disorder. It's a very well-designed, very carefully planned program of recovery and program of remediation. What it does is it permits a professional to continue to hold a license, and once they have reached a point of sobriety or abstinence that is sufficient according to the program, they can return to work under specific guidelines and supervision for a period of time designated by the Board of Nursing, which permits them to continue to earn a living and to practice their profession cleanly, unaffected by the substances that they were using in the past. So today, I thank you for your attention to this, and I don't expect anyone to be going out there with a specific mindset of, I'm going to identify the people in my environment who have SAD, but I would ask you to at least pay attention to things that might appear to be evidence that someone is experiencing SAD in the workplace. And if you discover something that you are concerned about, bring it to a supervisor that you trust and have that individual work with you to try to help this other colleague that you may be concerned about. So thanks again, and I hope you all have a good day.